Men and women are made differently, and for women, depending on that time of the month, it's often a challenge to keep bathroom breaks short and sweet. Here to give us a heads up on what every lady should know about proper feminine hygiene is Laila Reyes. She's a junior consultant of the Department of OB-GYN at the FEU NRMF Medical Center. Good morning, Doc.
Good morning.
To talk about this discussion early in the morning, but it's important for Filipino women to know this because
Yes.
I think it's a sensitive issue because we're very Maria Clara, you know. I mean, we are taught to have sex after our marriage, so a lot of people are very shy about going to gynecologists and even talking about sex. So in terms of feminine hygiene, what is proper feminine hygiene?
When you say proper feminine hygiene, it's a matter of feeling it. If you don't feel wet, if you don't have that itchy feeling, and you feel odorless, that's actually probably what you can say that you're having a proper feminine hygiene.
But sometimes people or women don't necessarily think about those things. Diba?
Yes.
It's hard because not everybody will call the minute they feel an itch or the minute they have a discharge, because actually natural feminine discharge is normal.
Yes.
So it's very hard to distinguish sometimes.
Yes, but you can actually distinguish. When you say normal discharge, its color may vary from clear to white. Or
That's natural
and it should,
pa.
yeah, and it should be odorless. We usually have these discharges every now and then. Usually, if you noticed, if you're ovulatory or in the middle of your cycle, you tend to get that clear mucus-like discharge. That's still normal. But if you begin to have yellowish, grayish white, as well as foul-smelling discharge, that tends to be abnormal, especially if it's accompanied by itchiness and burning sensation. That will be associated with abnormal discharge. Probably that's a time you have to consult your doctor.
But how do these circumstances come about, Doc? I mean, it's not every month that it happens when you get your period, because it's obviously a less clean time of the month.
When we talk about feminine hygiene, it's usually a challenge when you have your menses. Because actually blood is alkaline in nature, and the vagina is acidic in nature.
So it's the opposite spectrum.
Yes, the normal pH of the vagina is around 3.8 to 4.2. And blood, its pH is more than 5, particularly more than 6. So if there's blood in the vagina, it destroys the natural balance in the vagina. Particularly, it may lower the amount of the friendly bacteria. We have that, what we call vaginal flora. This vaginal flora contains the organism known as lactobacilli. This lactobacilli survives in an acidic environment. And the advantage of this lactobacilli is that it produces that hydrogen peroxide to keep the other organisms to keep our vagina protected from other organisms. So during menses, that's one challenge. Another is during pregnancy. When we have too much estrogen. When we have too much estrogen, fungus naman would like having the estrogen around. And another thing is during physical activity, when you perspire a lot in that area. Perspiration or wetness actually makes your fungus proliferate better. So at those circumstances, feminine hygiene will really be a challenge, because we want to have proper feminine hygiene to avoid infections.
But how does that happen, though? How would you say, or how would you rate someone who has poor hygiene? Because sometimes, let's say you're in the beach, Doc, because we were talking about it a while ago. You tend to stay in the beach the whole day. You get wet, obviously your bikini, and girls, I mean, unless the fashionistas like changing 5 times a day, a lot of women would stay in that bikini or in that bathing suit the whole day.
As I've mentioned, wetness will actually favor infection. One thing, diba, when you're wet, just like babies, diba, when you feel wet in that area, it tends to get itchy. So you get that rash when you scratch it. The abrasions would be one port of entry for the organism. Aside from that, again, fungal infections would thrive in wet areas. When you say hygiene, the recommended frequency of washing the perineal areas around twice a day, not too much. If you're so clean, you tend to also kill the friendly bacteria, and you get prone to infections. At least twice a day, that would be enough. Probably one in the morning and one before you retire.
Well, usually we do shower twice a day. But it's washing in the lower regions, obviously, that you're talking about.
Yes.
And with that, you recommend feminine washes.
Yes.
Because not everyone uses it.
Yeah.
Right?
Some of the ladies would use their ordinary soap.
Yes, correct.
We have to use, you know, I always tell my patients.
And they're more alkaline, Doc?
Yes.
Okay.
Yeah, I always tell my patients, treat your vagina the same way you're treating your face, because it's also sensitive.
Very sensitive, right?
Particularly, it requires a lower soap with a lower pH.
Okay.
You know, to comply with the pH of the vagina. So if you use stronger soaps, again, this may kill the friendly organism in that area.
And so what's the usual feminine wash that you would, I suppose, recommend? It has to be with a pH level that is the same, at par with
at par with close to the vaginal pH.
Right.
Now, when you say feminine wash, actually up to now, there's no we don't have that thing you call ideal feminine wash. When you say a proper feminine wash, it is individualized. It depends on you. As long as for you it's non-irritating and it's non-drying, it's hypoallergenic for you, and syempre, it should be affordable and friendly to the normal environment of the vagina. That could probably be what we could say an ideal feminine wash for that particular person.
So maybe, Doc, you can tell women out there that they should invest, perhaps, because usually on a monthly basis we have our necessary items that we need.
Yes.
Maybe they can invest as well in a proper feminine wash that can help them.
But I would just like to remind it that not all feminine washes could be used daily.
Correct.
There are some feminine washes that you could use at a particular time when your feminine hygiene is challenged, like during menses, because there's a particular feminine wash in the market that has a very good microbicidal property that could kill organisms that could cause infection, especially during those challenging days as in menses. Because remember, to stay healthy, we should protect every part of our body, including the vagina.
Correct. Well, Doc Lala, thank you so much for being with us this
You're
morning.
welcome.
And all the best.
Thank you.